A smartphone app developed at the McGill University Health Center is empowering patients by helping them monitor their own medical information. Through the Opal app, patients can check in on their appointments, view their lab results, and see their own clinical notes. So important. Joining us now is Dr. Tarek Hijal. He's a co-leader in developing Opal, and Nalie Agustin, a breast cancer patient who is currently using the app. Welcome to you both.
Hi, thank you.
Nalie, I want to start with you. As a patient, how is the app benefiting you? How do you like it?
For someone who's been blogging about my journey for almost 6 years now, the #1 advice that I give other patients is to be your own advocate. And this app has been such an amazing tool to do so. I have this huge binder at home of like printouts, 6 years worth of printouts of my medical records, my lab results, my appointment slips. So to have everything that I normally do manually through the app in the palm of my hand has been so efficient, so effective, and has relieved a lot of anxiety in such already anxious times. So I think that I recently changed hospitals, and the app has been a highlight in that transition, which is why I genuinely believe, I hope it can be accessible to all patients in all hospitals across the country.
Dr. Hijal, this app just won a provincial award for innovation. Sadly, a few days before that, one of the co-founders of the app, Lori Hendren, passed away. Tell me about her involvement in the app, or the involvement in the app, and not only that, but the feelings around the success of it.
So Lori was my patient. She was a breast cancer patient, computer science professor at McGill University. And we met at the consultation. Things clicked right away. And we decided to do something to improve the experience of patients at the Cedars Cancer Center at the McGill University Health Center. So she felt that waiting was a big issue for her, and the fact that she didn't have access to her own data, like you just said. So we decided with her and a medical physicist at the department, John Kildee, to develop an app where patients could have access to all their medical data, but to also improve the experience of patients through their journey with cancer, like checking in. They can go wait in the cafeteria to be called on their apps and see all their medical information.
It is a brilliant idea, applicable not just in your diagnosis, Nalie, but I can imagine in anybody who's dealing with long-term care. One of the things that we mentioned the app keeps track of is clinical notes. Are those your notes or a doctor's notes?
So they're actually doctor's notes.
Brilliant.
Go ahead.
No, exactly. They're doctor's notes, which I normally ask the reception to print out for me. But now to have it, especially when you're in the clinic with the oncologist, your mind is racing, so you'll never remember what he says. And normally I'm the patient with the notebook trying to write everything down, but now I don't have to do anything. It's all printed in the app itself.
Yeah, Dr. Hijal, where does the team hope to take this app in the future? You can see so many applications for it.
So yeah, we started in oncology because that's what we do, and there's a big need for oncology, but we see it expandable throughout the hospitals. So we're going to work now with the management of the MUHC to expand it to other departments. We're looking first to start with the HIV clinic, where patients need to monitor their blood tests very regularly, cardiology, and even some pediatric departments so that parents of children can also get the information for their kids. And ultimately, we'd like to expand across the province, if possible, with the government.
It is a brilliant idea and application. I want to thank you both for coming on Your Morning to tell us more about it.
Thank you so much for having us.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.